Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everybody. My name is Linda Hughes, Chair of the Alberta Health Services Board, and I wish to welcome everyone here at the 7th Street Plaza, as well as those watching from across the province through Facebook Live. I'd like to acknowledge that we are gathered here today on Treaty 6 and Métis Region 4 territory, a traditional meeting place and home for many Indigenous peoples. As this is the final public board meeting of 2018, I thought I'd provide a quick update on two transformational projects now underway at AHS that reached major milestones over the past 12 months. This year, AHS established Alberta Public Laboratories, or APL, a wholly owned subsidiary that will provide standardized lab testing for the entire province. Currently, several different organizations perform more than 75 million lab tests each year in Alberta, and these tests inform the majority of patient care decisions made every day. There are advantages to consolidating all these services within a single self-governed organization. Fully integrated lab services will provide Alberta patients with more timely and consistent results, and new testing capabilities will enable more specialized tests to be done here rather than sent to labs outside the province. This year, AHS and APL announced plans to work with the Alberta government and the province's universities to build a state-of-the-art clinical lab hub in Edmonton that will process about 30 million tests per year, while also driving research and providing training for lab professionals from across Alberta. This summer, Craig Ivany was hired as APL's Chief Executive Officer, and Dr. Lauren Terrell was named Chair of the APL Board. We're truly fortunate to have both these accomplished professionals help to lead this new organization. And earlier this week, lab staff that currently provide testing for AHS became official APL employees. Looking ahead, construction of the Edmonton Hub Lab is slated to begin early next year, with the new integrated lab model fully operational by 2022. Also this year, enormous progress has been made in the planning and designing of Connect Care, our new clinical information system. And I want to publicly acknowledge and thank our 45 patient advisors who are embedded in all levels of this planning and design work. Just as APL is consolidating lab services, Connect Care is consolidating health information throughout AHS and empowering our teams to work more collaboratively for better patient outcomes and patient experiences. Our clinical business and IT teams recently completed a 2-year project in Calgary and Edmonton zones to migrate all public health patient records and immunization information to the same digital system used by AHS's other 3 zones. This project involved electronically and manually converting 2.8 million patient records and transferring 31 million immunization records. A huge amount of work, obviously, and that project is helping AHS stay on track for a first launch of Connect Care at select sites in Edmonton. As you can appreciate, this is a very busy and exciting time to be involved with AHS, and on behalf of the board, I'd like to thank everyone involved in APL and Connect Care initiatives, both of which will help AHS deliver improved patient outcomes and experiences. I encourage everyone to visit the Connect Care and the APL web pages on the AHS website, that's ahs.ca, for the latest updates on both of those initiatives. Before I pass the mic to our President and CEO, Dr. Verna Yu, I'd like board members to look at the agenda for today and ask someone to move approval of that agenda. Richard, thank you. Hugh, all in favor? Carried. Declaration of conflict of interest. Does anyone have a conflict of interest you'd like to declare at this time? Okay, hearing none, we'll move along. You've seen minutes for 2 meetings, September and November meetings. Has anyone got any issues to raise or questions about those minutes? All right, could someone move approval? Rob, seconded by Brenda, all in favor? Great, carried. Thank you very much. And now I'll hand it over to Verna.
Great, thanks very much, Linda, and hello to everyone. As Linda mentioned in her remarks, Alberta Health Services is developing a new provincial advisory council to help address the unique needs of sexual and gender minority communities. HS currently has 3 provincial advisory councils that advise on province-wide health programs related to cancer care, addictions and mental health, and seniors in continuing care. These councils, commonly known as PACs, include public members who represent all zones, healthcare professionals, and stakeholders in their area of focus, and they play a significant role in shaping healthcare delivery. And I believe that our proposed 4th PAC has an important role to play in creating a safer and more welcoming healthcare environment for individuals who identify as LGBTQ2S+, that is, lesbian, gay, bisexual, transgender, queer, and two-spirited. Between May and October of this year, has met in person with more than 860 members of the LGBTQ2S+ communities and solicited feedback from more than 200 people through an online survey. Their insights and perspectives, as well as research and best practice, will guide the work of this new PAC. Recruitment efforts are underway, and we started the interview process last month. And today, the draft terms and reference and bylaws are coming to the board for approval. The health minister has also expressed support for this PAC. Once it launches, HS will look to this council to advise us on strategies to address stigma, bias, and discrimination these communities encounter when accessing and navigating the healthcare system. We'll also turn to the PAC to inform HS on how to support employees who identify with these communities. Healthcare is a people business, and that's why at HS we're focusing on creating environments where everybody feels welcomed, understood, and respected. Mandatory cultural sensitivity training for our staff, physicians, and employees is one way we're working toward that goal. The new PAC is another. We have a lot of work ahead of us in order to evolve into the truly inclusive healthcare system we strive to be, and there are signs that we're making progress. For example, HS was once again named as one of Canada's top 100 employers for the 2nd consecutive year. That suggests to me that we're on the right track. I believe this is also good news for Albertans, because if staff, physicians, and volunteers feel safe, valued, and respected at work, they're more likely to do their very best for the patients and families in our care. It's all about paying it forward and treating people as they wish to be treated. In fact, I have a video that exemplifies how AHS staff are paying it forward to patients and clients, and how, in turn, patients and clients are paying it forward to those in need in their community. Please take a look.
Alberta Health Services. Healthy Albertans, healthy communities, together.
The Adult Day program opened up in September of 2017. We offer respite for caregivers, and it's also a great place for the seniors to come. The charity lunch was an idea that we had based on the premise that a lot of times people lose their sense of purpose as they age. We really felt that our group needed to be doing something that provided them with a sense of purpose. So we pick the charity every month and see what their needs are, and then we work to meet them. Today we're doing 75 lunches. We have done 150 before. It is a need in our community. There's just no way around it. We have no shortage of people that we can continue to deliver these lunches to. Today we have Ray, who's doing some buttering for us, so he's the butter man today, and John, who's in charge of the eggs, so he will slop the eggs on there, and then we have Sid, who is in charge of closing the sandwiches and putting them in the bags.
What we feel is that as seniors we can be effective in our communities. It's, I think, important in that we are able to reach out to others and make ourselves useful in the community.
My way of thinking, I think they should, if the people are really hard up, yes, we should help them out.
Who's holding up the assembly line?
John is, he's breaking down.
As you can see, it's a hot mess.
Someone will be in charge of doing the juice boxes and the apples, and then it'll get passed down for the sandwiches to go in, and then the cookies will go in, and someone will seal them up, and into the fridge they go for tomorrow.
Provide daytime shelter and respite and just support for people experiencing homelessness. When the coordinator from the Adult Day program contacted the center about bringing in lunches, I was really excited. We do rely on community groups for all the niceties. The vision that we have at the center is that everyone would have a life-changing encounter with love. We couldn't be more thankful for the efforts of everybody associated with the Adult Day program and that they're really doing it under their own power too.
A lot of our clients don't work anymore. They might not be able to do the things they used to be able to do, but here you get a sense of purpose and you get a sense of pride.
We can be a blessing to those we serve.
I think that it is one of the best programs that I've ever seen.
Oh, we're crazy.
We crazy about each other.
Yeah.
Together, we do amazing things every day.
So the holiday season is upon us, and for many Albertans, it's a time of giving and a time of thinking of others. And this video is a reminder that although our AHS people are involved in the spirit of the season, their generosity, compassion, and altruism is on display year-round. So our people are truly special. I'd like to thank all the AHS staff, physicians, and volunteers for always going that extra mile on behalf of patients, clients, and families, and for supporting each other as colleagues. And I know that many of our people will be working on Christmas and New Year's. It's hard being away from friends and family during this time of the year, but I want them to know how much we appreciate their sacrifices and their dedication to making the season special for patients and families. I also encourage Albertans to enjoy the season, find time to take a break and recharge, and spend time with your loved ones over the next few weeks. May it be a safe and peaceful holiday season for all. Thank you for attending today.
Thank you, Verna. Now we'll move to our Quality and Safety Committee, and Brenda.
Thank you, Linda. So on the right page. The Quality and Safety Committee met on November 21st, 2018. The agenda items typically focus on 3 areas, and that's access, quality, and safety. Prior to getting into the agenda items, Dr. Belanger spoke to the great success of the recent AHS Quality Summit. Of the 461 attendees, 98% would recommend the summit to others. Highlights included the patient voice in every part of the project, the need to continually iterate, use design thinking and empathy as approaches for system transformation. The speakers and the content of the program were rated very high. The committee had an excellent presentation and discussion on the success of the COACT Collaborative Care Initiative, which is a healthcare approach adopted by AHS that has interprofessional teams working together in partnership with patients and families to achieve better health outcomes. The committee received an update on patient safety and heard about AHS's participation in the measurement and monitoring of safety in Canada, a learning collaborative that has been launched by the Canadian Patient Safety Institute. The committee was asked to consider proposed changes to the Quality Assurance Committee, the QAC structure of AHS, with respect to appointing a subcommittee as a standalone committee and renaming another committee. In 2010, the AHS board approved the AHS QAC structure. All modifications of the AHS QAC governance structure require the approval of the AHS board. The committee recommended that the board approve the proposed revisions to the AHS QAC structure. Accordingly, I move that the Alberta Health Services Board approve, number 1, that the Sturgeon Community Hospital Quality Assurance Subcommittee be appointed as a standalone QAC, and number 2, that the Community and Rural Hospitals QAC title be changed to the Suburban Hospitals Edmonton Zone Quality Assurance Committee. I so move.
Do I have a seconder? Marlis? All in favor? That's carried. Thank you. Now Finance Committee. Richard?
The Finance Committee met on November 22nd. Is that better? 2018.
The committee considered 3 items for recommendation for approval of the board. First, with respect to the second quarter investment report. As mandated by the AHS investment bylaw, the committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS's investment portfolio on a quarterly basis. The Regional Health Authorities regulation and the AHS investment bylaw describe the requirements for the board to approve or ratify by resolution AHS's investment decisions. The committee was presented with the 2018-19 second quarter investment report and recommended that the board ratify the transactions. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions described below. 1. As of September 30th, 2018, AHS held restricted and unrestricted funds managed by Phillips, Hager, and North Investment Management and Manulife Financial totaling $1.456 billion. 2. The funds were invested in short-term treasury bills, federal, provincial, and corporate fixed income bonds, pooled mortgage funds, bond funds, Canadian global equity funds. 3. All of the funds invested during the quarter ended September 30th, 2018 were invested in accordance with the investment bylaw and investment policy as certified by signed investment compliance certificates from AHS and PHNN. Is there a seconder?
Is
Because
there
I
a
moved
second?
it.
You move it.
I moved it in my remarks.
Good. And Rob seconds it. Good. All in favor? That's carried.
Next. The committee considered the approval of certain agreements with value of excess of $90 million. The committee recommended the board approve each agreement. The first agreement is a home care agreement with Bayshore Healthcare Limited. I move that the Alberta Health Services Board approve a 1-year renewal. Would you like me to start all over? It's okay. Approve a 1-year renewal agreement with Bayshore Healthcare Limited, and 2, delegate authority to the AHS President and CEO to sign the renewal agreements in accordance with AHS policy number 1100, delegation of authority and establishment of controls for commitments.
Could I have a seconder? Hugh. All in favor? That's carried.
The other agreements relate to Alberta health grants. I move that the Alberta Health Services Board approve the following Alberta Health Grant agreements. A, an agreement for the operation and management of the on-call programs and provision of on-call services by physicians for the period of April 1, 2018 to March 31st, 2020. B, an agreement for the training and compensation of postgraduate medical education students who work in AHS facilities and provide clinical services as part of their educational training for the period of July 1, 2018 to June 30th, 2020. And an amending agreement for the provision of cancer pharmaceuticals to outpatient cancer patients at no cost for the period of April 1, 2016 to March 31st, 2019. And delegate authority to the AHS President and CEO to sign the above agreements in accordance with AHS policy number 1100, delegation of authority and establishment of controls for commitments.
Thank you. Could I have a seconder? Hugh. All in favor? It's carried.
You're welcome.
Audit and Risk Committee, Hugh.
Thank you, Madam Chair. The Audit and Risk Committee met on November 22nd of 2018. Standard practice is that the staff from the Office of the Auditor General and KPMG are guests at the meeting in their role as external auditors of AHS. The committee reviewed the OAG and KPMG audit plan for the upcoming year. The committee discussed insurance, cybersecurity, and also received updates on risk management efforts and a quarterly report on the activities of the AHS internal audit and enterprise risk management team. There were no items that came through the committee for board approval. That is the report. Thank you.
Thank you, Hugh. Human Resources Committee, Marlis.
Thank you, Madam Chair. The Human Resources Committee met on November 28th, 2018. As Berna mentioned, we're delighted to report that AHS again earned the recognition as one of Canada's top 100 employers for 2019. It's the second year in a row that AHS has earned this honor, and congratulations to all. The committee received standing quarterly report on our people results and a labor relations update. The committee also received an update on the upcoming legislative changes that will reform governance of the local authorities' pension plan, critical role succession planning, the PeopleSoft system upgrade, as well as the update on risk management. There were no items for the board approval that came through this committee. However, in addition to the meeting report, I have been asked to present the following item for board approval. The terms and conditions related to the non-academic work Alberta resident physicians perform is governed by an agreement negotiated between the Provincial Association of Resident Physicians of Alberta, PARA, and AHS/the University of Calgary Cummings School of Medicine / University of Alberta Faculty of Medicine and Dentistry. The current PARA agreement expired, and a new tentative agreement was reached on November 7th, 2018 that will be effective from July 1st, 2018 to June 30th, 2020. The AH Board has also been asked to ratify this, or the AH Board has been asked to ratify this agreement. Accordingly, I move that the Alberta Health Services Board, 1, ratify the agreement between the Provincial Association of Resident Physicians of Alberta and the AHS/University of Calgary Cummings School of Medicine / University of Alberta Faculty of Medicine and Dentistry, effective July 1st, 2018 to June 30th, 2020. And, number 2, delegate authority to the AHS President and CEO to sign such an agreement on behalf of Alberta Health Services. I so move.
Thank you. Could I have a seconder? Brenda? All in favor? Thank you. That's carried. Community engagement. Back to you, Brenda.
Thank you, Linda. The Community Engagement Committee met on November 29th, 2018. Representatives from the David Thompson Health Advisory Council and the Stollery Children's Hospital Foundation attended the meeting. The committee considered 3 items for recommendation and approval of the board. First, with respect to the appointment of trustees to foundations, the responsibility to appoint trustees to established foundations lies with the AHS board. We're very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to healthcare in the province. Given the number of appointments, the names will not be read in this meeting, but will be incorporated into the minutes of the meeting and will be posted publicly. Accordingly, I move that the Alberta Health Services Board approve the appointment of trustees to health foundations as reviewed by the committee and the Alberta Health Services Board. I so move.
Seconder? Rob? All in favor? Thank you.
Second, with respect to amendments to the bylaws of Canmore and Area Health Foundation and Viking Health Foundation, the current bylaws for the Canmore and Area Healthcare Foundation are from 2008 and reference the Calgary Health Region. On September 18, 2018, the board members of the foundation voted to update the bylaws to the standard template for established foundations that AHS negotiated with Alberta Health. This will bring the bylaws into line with other established foundations. The AHS board is required to approve amendments to the bylaws and then submit them to the Minister for approval. Accordingly, I move that the Alberta Health Services Board approve the amended bylaws for the Canmore and Area Healthcare Foundation as reviewed by the board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable, and direct the same to be forwarded to the Minister of Health for approval. I so move.
Seconder? Hugh? All in favor? Carried. Thank you.
And next, the current bylaws for the Viking Health Foundation are from 2008 as well, and reference the East Central Health Region. On May 28, 2018, the board members of the foundation voted to update the bylaws to the standard template for established foundations as negotiated between AHS and Alberta Health. This will bring the bylaws into line with other established foundations. Accordingly, I move that the Alberta Health Services Board approve the amended bylaws for the Viking Health Foundation as reviewed by the board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable, and direct the same to be forwarded to the Minister of Health for approval. I so move.
Thank you. Seconder? Richard? All in favor? Carried. Thank you.
And finally, with respect to the terms of reference and bylaws for the new Provincial Advisory Council to support Alberta's sexual and gender minorities, Alberta Health Services is developing a provincial advisory council to help address the unique needs of sexual and gender minorities, lesbian, gay, bisexual, transgender, queer, and two-spirit, or LGBTQ2S+ communities. The PAC will advise AHS on strategies to prevent the stigma, bias, and discrimination that these communities encounter when accessing and navigating the healthcare system. The PAC will also inform how AHS supports employees who identify with these communities and work within them. Accordingly, I move that the Alberta Health Services Board approve the terms of reference and bylaws of the Provincial Advisory Council that is proposed to be called the Sexual Orientation, Gender Identity and Expression Provincial Advisory Council in the form reviewed by the Board with such non-substantive changes that management of AHS considers necessary or advisable, and submit the bylaw to the Minister of Health for approval. I so move.
Thank you. Could I have a seconder? Marlis? All in favor? That's carried. Thank you. Governance Committee, Hugh.
Thank you, Madam Chair. The Governance Committee met on November 29th of 2018. In addition to receiving routine updates on the status of preparation for accreditation in 2019 and the quarterly update from the Chief Ethics and Compliance Officer, the committee considered 3 items for recommendation for approval of the Board. First, with respect to the whistleblower policy, amendments to the Public Interest Disclosure Whistleblower Protection Act, known as PETA, came into effect March 1st of 2018 and compelled revisions to AHS's Safe Disclosure Whistleblower Policy and related governance documents. The committee recommended that the Board approve the revised policy. Accordingly, I move that the Alberta Health Services Board approve the revised whistleblower policy and frivolous and vexatious disclosures procedure in the form reviewed by the committee and the Board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And I so move.
Thank you. Seconder? Linda? All in favor? Carried. Thank you.
Second, with respect to the Conflict of Interest bylaw, the Ethics Commissioner accepted the Conflict of Interest bylaw that was proposed. In order for the Conflict of Interest bylaw to have effect, it must be approved by the Minister of Health, and the Board's formal approval of the Conflict of Interest bylaw is thus sought prior to seeking ministerial approval. Accordingly, I move that the Alberta Health Services Board, 1, approve the Conflict of Interest bylaw in the most recent form reviewed by the committee and the Board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. 2, authorize and direct management of Alberta Health Services to deliver the amended draft AHS Conflict of Interest bylaw to the Minister of Health for approval. And 3, following such approval, to make the Conflict of Interest bylaw available to the public through the Alberta Health Services website. And I so move.
Thank you. Seconder? Marlis? All in favor? Thank you.
Third, with respect to the revised terms of reference, at its October 15th, 2018 meeting, the Governance Committee reviewed the terms of reference for all Board committees, as well as the terms of reference for the Board, Board Chair, and Board Member. The committee requested amendments to the terms of reference for all committees, as well as the terms of reference for the Board. There were no requested changes to the terms of reference for the Board Chair or the Board Member. The Board has reviewed the revisions and wishes to approve. Accordingly, I move that the Alberta Health Services Board, 1, approve the amended terms of reference for the Board, the Audit and Risk Committee, the Finance Committee, the Governance Committee, Human Resources Committee, the Community Engagement Committee, and the Quality and Safety Committee, and 2, direct that the revised terms of reference be posted on the AHS public website. And I so move.
Thank you. Seconder? Richard? All in favor? Thank you. That's carried.
Thank you. Those are the matters for governance.
And thank you. With that, I would declare us adjourned. Thank you all for coming today.
Together, we do amazing things every day.